We begin the discussion about the liver, about what the liver does. It cleans the blood, produces bile, and stores energy in the form of glucose called glycogen. We look at what the spleen does, and it plays the multiple supporting roles in the body. It acts as a filter for blood as part of the immune system, and old red blood cells are recycled in the spleen, and platelets and white blood cells are stored there. The spleen also fights bacteria that cause pneumonia and meningitis. Now, hepatitis A occurs following ingestion of food contaminated by feces of a hepatitis A person. They must always wash their hands. And you can't have hepatitis D unless they have hepatitis B. Hepatitis B and C is usually as a result of sex with an infected partner, receiving transfusion, or using an infected injection needle. The medications acetaminophen, phenytoin, halothane, and methyl-dopa are medications that can cause toxic hepatitis, which means it is infectious to the patient, not to other people. Treatment is IV hydration with vitamin C for healing may be ordered, vitamin B complex to help absorb fat-soluble vitamins. All unnecessary medications, especially sedatives, should be avoided. Vitamin K may be ordered if clotting time is prolonged. And to treat symptoms, these patients may get Atarax or Tygan before meals for nausea. A decreased BUN usually may be problems with the liver, whereas an increased BUN, you think kidneys. Bed rest is recommended for the first several weeks, generally at home unless the serum bilirubin is greater than 10 or the PT is prolonged. If either occurs, hospitalization is usually recommended. Once bed rest is no longer necessary, activity should be increased gradually because fatigue will be present for up to several months. Rest periods should be included throughout the day. Vital signs are the priority action due to the possibility of hepatic bleeding. If the patient had a liver biopsy, then the patient would be placed on their right side with a pillow under the costal margin and kept on bed rest for several hours to decrease the risk of bleeding. Hepatitis B vaccine to a patient has been effective when the specimen of the patient blood reveals anti-Bs. The presence of surface antibodies to HBV, anti-Bs, is a marker of a positive response to the vaccine. Anorexia and weight loss is often an early and severe symptom of hepatitis. What would be late signs is ascites, jaundice, elevated liver enzymes, and total bilirubin. Jaundice occurs with liver disease because of the inability of diseased liver cells to clear the bilirubin from the blood. Bile is deposited in the skin and sclera, producing the yellow discoloration. Most healthcare workers are at risk for hepatitis B and C, and most patients with hepatitis have flu-like symptoms, weight loss, hepatomegaly, jaundice, dark yellow urine, and light stools. The stools are clay color, also known as steatorrhea, which shows a decreased hepatic function. Encourage low fat, low protein, high calorie, and frequent small meals. Alkaline phosphatase would be slightly elevated. CBC would be decreased because of the shortened life of red blood cells, or hemorrhaging. White blood cell count and differential, leukopenia, leukocytosis, monocytosis, atypical lymphocytes, and plasma cells may be present. Serum albumin is decreased. The blood glucose could be transient hyperglycemia or hypoglycemia because of the altered liver function. Prothrombin time may be prolonged because of the liver dysfunction. The serum bilirubin may be above 2.5. If it is above 200, then a poor prognosis is probable because of the increased cellular necrosis. On this picture you see on the left is a normal liver, the middle is a fatty liver, and then on the right is a cirrhotic liver. Now, a fatty liver can improve if a diet is changed. The nursing priorities is to reduce demands on the liver while promoting physical well-being and prevent complications. The discharge goal is meeting basic self-care needs, complications are prevented or minimized, deal with the reality of a current situation, disease process, prognosis, and therapeutic regimen understood, and having a plan in place to meet the needs after discharge. The pancreas has two functions, in the endocrine and exocrine. The endocrine function is the production of insulin. Exocrine is the digestive enzymes. There are two types of pancreatitis, acute and chronic, and the number one cause of acute and chronic is alcohol, because alcohol destroys the GI tract. The pancreas makes the digestive enzymes, and as long as they are inside the pancreas, they are not active. But when the pancreatic enzymes become active, they digest, and we don't want them to digest in the pancreas. So every time you eat or smell food, the enzymes move into the pancreas until they finally get into the small intestine. When they get to the small intestine, they activate, and it's okay to activate in the small intestine. But what happens if a person is an alcoholic? The GI tract is getting destroyed, and they get scar tissue. And the scar tissue can cause an occlusion, and the enzymes can't get out of the small intestine, so it backs up into the pancreas. Now, acute pancreatitis usually begins with pain in the upper abdomen that may last for a few days. The pain may be severe, and the pain may become constant, or it could reach the back and other areas. It may be sudden and intense and begin as mild pain that gets worse when food is eating. Somebody with acute pancreatitis looks and feels sick. They have swollen tender abdomen, nausea, vomiting, fever, rapid pulse, and severe cases can cause dehydration and low blood pressure. The heart and lungs and kidneys can fail, and this becomes a multi-system organ shutdown. If bleeding occurs in the pancreas, shock and death can happen. One of the main symptoms of pancreatitis is pain, and there's degrees. If they have a small case, they may be on a med-surg floor with an NG tube to suction. They are MPO and just feel uncomfortable. But then if you have someone who has a very bad case of pancreatitis, where it's really digesting itself, the toxins are released in the body, and this can begin that multi-system breakdown. Because the toxins, they're released in the body, and the patient could have arrhythmias, they could have respiratory issues, they could have a renal shutdown, and die from complications of severe pancreatitis. They can have abdominal distension, ascites, and pancreatic enzymes can damage the capillaries, which are causing the ascites. Most pancreas transplants are anastomose to the bladder and drain pancreatic enzymes into the urine. When the pancreas is rejected or functioning inadequately, the level of pancreatic enzymes in the urine decreases by 25% or more. Patient may be given pancreolipase, which is a pancreatic enzyme replacement. The presence of steatorrhea would indicate that the dosage of pancreolipase may need to be adjusted. Respiratory failure can occur as a complication of acute pancreatitis, and so maintenance of respiratory function is a priority goal. Now this picture is showing a bluish discoloration of the umbilicus called the Cullen sign, and this is present in massive gastrointestinal hemorrhage resulting from free blood present in the abdomen. A palpable abdominal mass could indicate the presence of a pancreatic abscess, which then would require surgical drainage to prevent sepsis. So absent bowel sounds, abdominal tenderness, left upper quadrant pain would be all common in acute pancreatitis. A gray Turner side you would see if a patient is lying on their back and the blood can settle, and this is where you would see bruising in the flank area. And this can be specific to pancreatitis. It can also be intra-abdominal bleeding, pancreatic enzyme leakage into the peritoneal cavity. They could present shock, and a patient would need IV fluids ASAP. If ecchymotic areas are noted, then check to see if abdominal guarding or rigidity is present, which could indicate peritoneal irritation from internal bleeding. Pancreatic cancer requires effective pain management and would be necessary in order for the patient to improve nutrition, be receptive to education, or manage anxiety or depression. The nurse may palpate an abdominal mass, which is a swollen pancreas. The patient may have a rigid board-like abdomen. Anytime one part of the GI tract gets sick, expect other parts of the GI tract also to get sick too. If the gallbladder is sick, then it may make the pancreas sick. If the pancreas is sick, it might make the liver sick. If the liver is sick, then it could affect the esophagus. Treatment for pancreatic cancer would need to decrease gastric secretions by keeping the patient MPO. Remember that you want to try to keep them empty and dry, and that's why they have the NG tube to suction. If anything gets into their stomach, the pancreas thinks it needs to make enzymes, and that's what makes them hurt. The patients may also be given steroids because that would reduce inflammation. And if they're on steroids, check their blood sugar. Anticholinergic drugs would also dry them out. The patient may get IV medications to decrease their stomach acid and may get H2 receptor blockers because they want to decrease the overall acid production. When they start eating again, they can ease back into the diet. Depending on how sick they might get, they may also be on total parenteral nutrition.